This class we will view the dissection video of the abdomen. Part 1, the abdominal wall. Now let's review the layers of abdominal wall. In this picture here are 6 layers. Omit the deep fissure. If plus deep fissure, there are 7 layers. Skin, superficial fissure, deep fissure, muscles, transverse fissure, extraperitoneal tissue, and parietal peritoneum. They are the cutaneous nerves on the inside the superficial fissure. They are anterior cutaneous nerves. They are lateral cutaneous nerves. They come from this trunk, intercostal nerves. Intercostal nerves that's the anterior branch of T nerves, thoracic nerves. For example, T10 to the umbilicus level. Now, T12 is about here. It's the mid part between the umbilicus and the pubic symphysis. There are 2 nerves from the lumbar plexus because T12 cannot reach inguinal region. The muscles different in the different wall. Anterior wall, only one muscle, rectus abdominis. And between the belly, you can see this is a tendinous intersection. Maybe 3, maybe 4. Lateral wall, there are 3 layers muscles. Obliquus externus abdominis, obliquus internus abdominis, and the transversus abdominis. And behind this rectus abdominis, there is a tendon or aponeurosis. And in front of it, also the aponeurosis. This is the fiber direction of the 3 layers: externus, internus, and transversus. Linear elbow abdominis, upper wider, lower is narrow. This is the 2 side aponeurosis fused together. Semilunar line, the sheath of rectus abdominis, anterior layer and posterior layer. Posterior layer lower border is a arcuate line. Behind it, directly the transverse fissure. This is the above arcuate line, the layers. Below arcuate line, the lower layers. Skin, superficial fissure, deep fissure, and the sheath of rectus abdominis. Then rectus abdominis. Then still the sheath, anterior sheath and posterior sheath. Transverse fissure, extraperitoneal tissue, and parietal peritoneum. But below the arcuate line, lower, behind the muscle here, no sheath. All of the aponeurosis go to the anterior layer. So this muscle directly lie on the rest on this transverse fissure. Okay, let's view the video. This time is to dissect the anterior and the lateral wall of the abdomen and expose some nerves and vessels. For example, this muscle, obliquus externus abdominis, and the sheath of rectus abdominis. The intercostal nerves and the transversus abdominis, the obliquus internus abdominis. Along the anterior median line to cut open the skin around the umbilicus from the leafball process to the upper border of pubic symphysis. Then along this anterior superior iliac spine, this level, do a transverse incision. Then peel the skin to the lateral side. Then still along the anterior median line to cut open the superficial fissure. Along the costal arch to the anterior axillary line. Then peel the superficial fissure to the lateral side. We can see these nerves are anterior cutaneous nerves from the thoracic nerves, anterior cutaneous nerves and vessels. Beside the median line. Now from the anterior axillary line, these nerves are lateral cutaneous nerves from the intercostal nerve. They are in the superficial fissure. Then dissect this superficial fissure, remove them, expose the deep fissure. This is the deep fissure on the surface of obliquus externus abdominis. Now still from the lower border of the pectoralis major, then along the costal arch, along the mid-axillary line, cut open along the inguinal region, cut open this deep fissure. Remove this deep fissure from the obliquus externus abdominis. You can see this muscle fibers direction of this externus muscle is from superior lateral to the inferior medial. Now at this line is continuous to the aponeurosis. No muscle fiber, no body. Along the costal arch, open this externus muscle, along the mid-axillary line, along the inguinal ligament. Now here, open this aponeurosis of obliquus externus abdominis. Now this is the second muscle, obliquus internus abdominis. It's similar to a fan. It's a fan shape. So along this line, costal arch, mid-axillary line, and inguinal ligament, this line, open the second muscle. So expose the deep muscle. This is a transversus abdominis. Between second and third layer muscles, you can see these nerves. They are intercostal nerves. They are anterior branch of the T nerves. Okay, still along these lines, open this transversus abdominis. So notice the intercostal nerves, their position. They are between the internus and the transversus, between the second layer and the third layer. Okay, this is deep to this muscle. This is a transverse fissure. They are extraperitoneal tissues. This one is the paratoperitoneum. So they are last 3 layers of the abdominal wall. Here's the anterior median line. Now beside it, this is the sheath of rectus abdominis. Now we will open this anterior layer of this sheath. Beside the median line, do a vertical incision. Then do another 2 transverse incisions. Separate the sheath from the rectus abdominis. Can see here, this tendinous intersection is closely joined with this sheath. Okay, this is the rectus abdominis, this long muscle. This is the tendinous intersection 3 to 4. They divide this muscle into 4 to 5 bellies. Then transverse cut open this rectus abdominis. Expose the posterior layer of the sheath. The muscle is loose connected with the sheath, posterior layer. Deep to this muscle, look at these nerves are still intercostal nerves. They supply the rectus abdominis, deep to the rectus abdominis. Okay, this is the posterior layer of the sheath, rectus abdominis. Now look at about 4 centimeters under the umbilicus. This free border is the arcuate line. Then this vessel is superior epigastric artery and vein above the umbilicus. Below umbilicus, now this vessel are inferior epigastric artery and veins. Supply the rectus abdominis. So look at, this is the anterior layer of the rectus abdominis. Between them, now here there's a linear elbow. So we cut open here from the linear elbow or anterior median line. Here we can see here no muscles, directly the extraperitoneal fat tissues and the paratoperitoneum. Now from upper and lower, do 2 transverse incisions. Look at the layers of abdominal wall. Here is rectus abdominis. Here is the anterior layer, posterior layer of the rectus abdominis sheath. The anterior layer is continuous from the externus muscle. Now this is aponeurosis. Then the second internus is muscle. The aponeurosis is divided into 2 layers. Anterior layer in front of this muscle, posterior layer behind this muscle, and the transversus directly behind this muscle. So this is the anterior sheath and posterior sheath. Here is transverse fissure and the parietal peritoneum. Here is the linear elbow. So linear elbow, this is extraperitoneal tissues, and transverse fissure and the parietal peritoneum. Then below the arcuate line, look at the layers. Rectus abdominis, anterior sheath, here no posterior sheath. Anterior sheath is formed by this aponeurosis of externus, aponeurosis of internus, and aponeurosis of transversus. All of the three muscles aponeurosis go in front of the muscle. Now here is transverse fissure and the parietal peritoneum. Here still linear elbow, extraperitoneal fat tissues, parietal peritoneum. Okay, summary. Let's summarize the layers of the abdominal wall. The first layer, skin. Second layer, superficial fissure. The third layer is the deep fissure of obliquus externus abdominis. The fourth layer, muscles. First muscle, obliquus externus abdominis. Obliquus internus abdominis. Transversus abdominis. The fifth layer is transverse fissure. Sixth layer is the extraperitoneal tissues. And the seventh layer is the parietal peritoneum. Beside the anterior median line, this is the anterior sheath of the rectus abdominis. This muscle is rectus abdominis. This is posterior sheath. This is arcuate line. This is the transverse fissure and the parietal peritoneum.